I'm Wu Yin Ling. I'm a professor of obstetrics and gynecology at the University of Malaya. I'm also a senior consultant in gynecological oncology practicing at University Malaya Medical Centre. I've always wanted to do gynecological oncology. As a very young student and house officer, I had the privilege of working with a team that really demonstrated empathy. And being an impressionable young doctor, I did say to myself, that's exactly what I wanted to do because it will be very meaningful to afford women the respect and the care they needed throughout their journey, even if it's a more surgically inclined specialty. As doctors, we assume we know what patients go through, but very often we don't have the time to listen, and formal studies will identify issues that are culturally different across the globe, and that will help us to better facilitate their care for them. It is important that we take into account the experiences of lower middle income country or the global south. The culture, the health systems are very different. And in order for us to care for them better, such diverse patient experiences are extremely important, if not critical, in how we formulate their care pathways. So in order to care for patients better, it is extremely important that we have a good patient-doctor relationship. Very often they don't tell you or what their personal struggles are, particularly in the financial side or who looks after that at home. And one of the things we realize that we do often rush in and out to talk about treatment, but we don't look at things that holistically. Now, in our setting in the global south or low income countries, sometimes you do not have the necessary support, such as specialist nurses or social worker or counselors to help facilitate the care. And therefore, to build the relationship between the patient and their doctor, or to understand their experiences, will be very important for us to journey with them better. We know that disease is just one aspect of the whole patient as a being. Knowing their social circumstances, what they're able to pay for, who looks after them at home, what their personal beliefs are, particularly with end-of-life care, that's very important in terms of formulating how we look after them and what we have to offer them. As doctors, we may not be prepared to deal with the end-of-life issues very well. Very recently, I had a patient who had recurrent ovarian cancer, and no more treatment was available for her. She accepted that very well. She registered herself through palliative care. And in her words, this was the thing that she feared most, the symptoms and waiting for death, because she's ready for death. But yet that journey is not so simple for her. And I wondered how we could care for her better or make things a bit easier for her. It wasn't symptom control. It wasn't death that she was afraid of, but it was that waiting for death to happen. I figured that that was a very scary experience for her. And as a doctor, I'm very limited in what I can do for her, but perhaps support groups or her own spiritual support groups, to be able to link her to those type of care may have been good as part of her journey. The best part of my job is being able to journey with patients and to have that relationship. It is a privilege. We share a lot, we laugh a lot, we cry a lot, but that is the meaningful bit of my job, to have relationships built around my everyday work. I always say that I don't need to read biographies or at all, because the work that I do is very rich, and the intersection with many individuals through various cultures really impact and affect me personally in terms of growth, because it makes me appreciate what I have, and that goes with the team as well. So I don't exist to help them, but they have helped me grow as an individual as well. And I think that is a bit of my job that I enjoy very much.